this week that, I think the guy was difficult, but we have a lot of new people. And so I'll tell you 4 or 5, anytime that dog control brings in a dog to be neutered, that has to be neutered, they have to have the owner has to come down and sign the treatment release and the pre-anesthetic form. So they need to come down before we place the dog in our anesthetic and go through all that mess. Otherwise we can't do it. There's something else I was gonna say. Dr. Wilson and Roger are still out, so if you guys need something, don't hesitate to contact Roger, but I think for the majority we've been getting by fine. So
So does dog control bring the animal down?
Yeah.
So then that
Well,
needs
it's
to come
kind
in separate.
Yeah, the
Oh,
animal
the
shelter will bring it
shelters.
in. Yeah.
Okay.
Yeah.
So now they're coming in separate.
Yeah. Just so everybody knows. How do you get your sound out? I think that's it. I told these girls though that today we might have to turn some people away just because it's just you. So I'll have to be good about explaining and then we can see if they can schedule an appointment. I've been telling clients just so that they know we're like a week scheduled out. So, and then like the Tuesdays and Thursdays appointments were, I think almost 2 weeks scheduled out. So if people wanna make an appointment, they should do it sooner rather than later.
They just kind of check with me and see where we are. You know, they're welcome to wait. So
Yeah.
they just need to be aware that it's gonna, you know, potentially be a long wait time. So if they feel like their animal's really sick, I said, you don't have to turn them away. They can still wait. They just need to be aware that,
Give them an option.
yeah.
Okay.
So,
I think that's it. How I don't have anything. They haven't turned our phones over yet, so the calls aren't being recorded quite yet. So I'll let you guys know when that happens. We don't. I think it's more towards like September.
what's happening with that?
We're doing we're having a company come in and they're gonna like monitor our phone calls.
Okay.
And then each person's gonna be rated like on how they answer the phone call, if they're able to schedule appointments, and then you'll be able to go back on and see your rating and listen to your phone calls. So then that way they can help us a little bit.
Like this call is recorded for training purposes type thing.
Yeah, I don't know if it's gonna say anything different or not, but it's gonna be a separate company doing it, and then they'll just give us kind of our ratings, and we can go on and listen. Yeah.
Cool.
And I guess we're getting new phone systems with that too. So we'll be putting a phone by Treatment Sync 1, and I think that was the only new place, and then there'll be some cordless ones too. I don't know when all that's taking place either. So should we determine it? That's it.
Anybody else have anything?
Flaps and handling.
Last?
Okay.
Okay. So, the plan today was just to talk a little bit about leptospirosis, or lepto for short, because we've had a couple cases recently. It's not something that we see real commonly. So, I'm the client, and I need to know a little bit about lepto. So we keep it fairly simple. But if I need to know a little bit about it, what type of an organism is lepto?
The virus.
Bacteria.
Bacteria. Yeah. Bacteria. And, yep, and it's actually a little spiral shaped bacteria, and so they call it a spirochete. But that's important because it can actually move. So there's certain bacteria that are motile that can move, and so E. coli is one of them. They have a little flagella on the end of them so they can wiggle, and so the spirochete bacteria are also motile. So here's a little picture of them, and you probably wouldn't even be able to see it on our regular microscope. You'd have to get that electron microscope to see that size. And the important thing about it being a bacteria is how would we treat it?
Seems like Jake put the dog on fluids, put it on antibiotics.
So that's the key there is antibiotics. So if it's a bacterium, that is what antibiotics are for. Very specifically, antibiotics treat bacterium. If it's a virus, like parvo, that antibiotic doesn't treat it at all, okay? So the fun little fact about a bacterium versus a virus is that if a bacterium is the size of a balloon, then a virus is the size of a head of a pin. So a virus is incredibly tiny. It's actually just a tiny piece of DNA. It's probably not even alive. There's debate about whether or not a virus is even alive, but it's just a tiny piece of DNA and it takes over a cell and it forces it to reproduce a virus. So bacterium is better because I can treat it more effectively with antibiotics. And so that's why we had that animal on fluids, we gave it antibiotics. And what animals get lepto? Yes, mammals. Well, different way to say it. So, what species might get lepto?
Only 6 months and raccoons.
Rats.
Definitely rats, rodents, deer, and possums. And what animal do we treat here? What do we know about them? Just dogs, yeah, so dogs.
The
Cats don't get it.
And cats are pretty resistant, so cats don't usually get it. So mainly dogs. So we're not vaccinating cats for lepto. They're pretty resistant. And people. So that's kind of the scary part, is that it is zoonotic, so people could get it. And where would a dog pick it up? The most kind of a common place dogs might get it.
Puddles.
Puddles, yep.
Backyards, I guess, nowadays.
So if it's the desert, what are your chances of getting lepto in the desert? Pretty low. So anywhere where it's warm and wet, that's where that lepto is going to be. And so like this summer we had a nice cool summer. You know, a lot of times we've been in a drought and it's dry and we saw 0 lepto. But if it's warm and cool and there's water around, then that's where they're going to be. And we have our canals, and so I think they're watering from the canal system. And so if there's a little muskrat that's swimming around in the canal and he's urinating in the water, and then you're watering your lawn with that water, then there's a higher risk for contamination. And it could be deer or any other animal.
Do goats get it by chance?
I'm not sure specifically about goats.
I
We'll have
don't
to
think
look
so. I've
them
had
up.
goats and I asked my large animal vet about it and he doesn't think so. But that was one vet I asked.
I haven't heard about it too much in like livestock, but I'd have to look up specifically. I don't know all the species that are prone.
Okay.
But I know we always worried about deer, skunks, and then rodents are a big one. So I was thinking about that when I was looking at this. I'm like, oh, those dang little muskrats that are in there. I bet they are a problem. So, and then what should people do to help prevent their dog from getting this disease?
Vaccinate because it only covers like 4 strains. Don't let your dog drink out of puddles while you're on hikes and stuff. Can't do much about your backyard.
How many strains are there then?
This says over 250 serovars that are classified into at least 10 groups. So right now there's only 4 that are in the vaccine, but there is a hope, that it can be cross-protective. So specifically, the vaccine would prevent you from getting those 4, so you're developing antibodies against those 4. But there is still a chance that even if you have the vaccine, you could get infected with a strain that's not in the vaccine. But the hope would be that they would be a little more protected, a little more prepared to fight it off.
But that's what happened with Dr. J's dog, right? He was vaccinated already.
Yeah, I think there was one we had that had no vaccine,
Yeah.
and then one that did have a vaccine. Now it seemed to get better a little bit quicker.
Yeah.
You can't really say just with one case, but
Yeah.
But I think it's worthwhile enough to get the vaccine, and we know that vaccines are pretty safe. So people might talk about, oh, my dog had vaccine reactions. It is considered, that extra vaccine, so not core but elective, and so they kind of evaluate it based on risk. But we're pretty good at handling any vaccine problem that might come up. And so if their dog does show sensitivity to that vaccine, you can skip it. But I do think that we should probably be vaccinating a little bit more. And then the other thing that the sea lions on the coast had it too. So sea lions on the coast. So if people are going to the coast or anything like that, it's a good idea to have that vaccine.
Do the deer and stuff that have it, do they die from it, or do they kind of live with it?
So either way could happen. So with any species that gets this disease, some of them can get really, really sick and die from it. And it sounds like about 10% of them probably get a really bad version of it. And then there's another portion that just get a fever, and then they feel better, and then they might be carriers and be shedding that bacterium. And then, what we're doing when we're treating them here in hospitals, we're trying to clear that bacterium from their system so that they're not shedding it. But yes, animals in the wild probably do die from lepto, and then the ones that are left are resistant and are probably just carrying it in their body and shedding it.
You have to say for dogs then?
Yep, same with dogs. So a dog could potentially, have been infected and not really shown clear signs, and could be a carrier. And probably a little more common in, our southern climates that are warm and wet, and really, probably many, many dogs are testing positive for lepto. The other fun fact is that they can pick it up through their feet. So again, that bacterium is motile, so if there's a crack on their foot or a little puncture wound of any kind, you could get it even from walking through water. Same with a person, so you could get it through cracks in your hands. And so that's why it's really important to wear gloves. You should probably wear glasses too if we have one in a case, because you don't want stuff splashed into your eyes. You could get it that way. And what organs are we really worried about when the dog is infected? Liver, yeah, and one other one.
I'm gonna just say kidney.
Yeah, liver and kidney. So that's what I always tell people. It can cause liver and kidney failure. The bacterium actually can go anywhere. So it can go in the lungs, it can go in the central nervous system and cause neurologic signs. But the most common things that we see are kidney failure and liver failure. You can actually get a long-term effect from that. You can have long-term kidney disease or long-term hepatitis from having the infection. So that's even with treatment too. So you can have long-term effects on liver and kidney. And the thing that it can cause is vasculitis. So to me, vasculitis is one of the scariest things that can happen, because all of your blood vessels are inflamed, and your body does not like having inflamed blood vessels. You get reduced blood flow, you get ischemic, so the lack of blood flow causes cellular death. So that could happen anywhere: lungs, liver, brain, kidneys. And so if the vasculitis is severe, it can cause big problems in a hurry. So when we're here treating them in hospital, having them on fluids is really important. You want to increase your tissue perfusion, and then having them on antibiotics, again, really important. Kill that bacteria, perfuse the tissues, and then managing inflammation. A lot of times they're sick, that fever, vomiting, all of that. And then, how do we vaccinate for lepto? So I have my dog, so what do I have to do to get my dog vaccinated?
You get one and then a booster 3 to 4 weeks later, and then once a year.
And then every year. So this actually says that it's effective for 9 months, some say a year.
Oh.
The vaccine company says a year, so they should be coming in every year to get that lepto booster. It's not going to last over a year. So
Is the lepto vaccine guaranteed the way parvo is? Like, do they pay for treatment?
I don't know, Phil says no.
I would bet no, because that'd be a bad bet. Because you know for sure that it's
Yeah.
not 100% effective. And we're pretty sure that that parvo vaccine is 100% effective if done correctly. So at least 99% effective. There's always going to be that one case, but 99% effective. If they do a vaccine and then they keep up on their boosters, the dog's not going to get parvo. There's a chance that, you know, if it's a new dog and they're a little bit late in getting their vaccine and it could have been exposed before you got the vaccine. So you could have maybe a puppy with only one shot that got that got parvo. But by the time they get that second booster, you should be pretty well protected. The same thing with distemper in cats. If they've had 2 vaccines, they should be, 99% protected. With distemper in dogs, 1 vaccine. So that's why I always shake my head when they come in with distemper, because 1 vaccine, you're protected from distemper. So get your vaccine. So, and rabies also. Rabies highly protective, so 99% effective. So you get that rabies shot, you're not going to get rabies. So, lepto, and then again, that's why it's kind of considered that optional one. It does offer some protection. I do think it's important, but it's not 100% effective, and so if they're high risk, they should get it. Or, even if we're not perceiving high risk, I think any animal should hear about it. We had some animals in town. If you're near a canal, if there's any muskrats nearby, if there's mice in your yard, if you're getting deer, anything like that, they should have it. Okay, so it's a bacterium, and it infects dogs. They get it from contaminated water sources, and if the ground is moist, that could be grass. A lot of times you'll see it with flooding. Vaccine is partially protective, so we encourage people to get the vaccine every year. And if they get it, it can cause liver and kidney failure. And that's kind of my little 30-second speech when I give it to owners. So contaminated water sources, especially if wildlife, and it can cause liver and kidney failure. Any questions?
They can get it more than one time, right?
Correct. Yeah. And that's, again, I think too, because there's so many serovars, that they could get it again. So stay up on that vaccine. And these 2 little handouts, this one that I sent around, and then there's another one, which Bethany really liked this one. I like this one better. But these are on Veterinary Partner, and you can just log into Veterinary Partner. You don't have to have a password. You can just log in and print it out. So if somebody really wants to have a little handout, this one's really, really good. You can just log in, print it out, give them a little handout. We used to have little flyers on lepto too. We should see
Yeah,
if we should
check
get
the
some more.
drawers, there might be
Yeah.
some in there.
See if we can get some more of those. Give to people so that if they want a little, because you know, they're not gonna remember when they go home weird new names and what is this thing I'm supposed to get. I didn't want to think about it. So, yeah.
I don't have any more questions. Chandra, do you?
We made sure we got the vaccines with the 4 strains.
Yes, and so everybody
I
knows
didn't
we
even-
have just the lepto and we have the DHPP with lepto, so if you're just grabbing a lepto, grab it out of the lepto box, not with DHPP with lepto. Okay. And I think Jay labeled them in there too, or somebody did.
I double checked, we made sure we had all 4 strains. I don't know why they would make one with just 2 strains, because that seems ridiculous
Yeah.
to me.
So,
I didn't even know that they did that, so I made sure we had all 4 strains, and probably we'll be watching, I would imagine that they might add little strains in there as time goes on, if they're finding one that's more common. So, they're always doing research, and if they're seeing a certain strain as dogs are picking up and getting sick, then they may add that to the vaccine, so.
We should show this to Kim. When McKinley was here with lepto, she refused to wear gloves during her treatments because, it's only in her urine. That says blood and tissues too. I just
Actually,
shook
that
my
was
head
a
at her.
huge argument that we had down
Was
there.
it?
Whether
Yeah, there
it
you
was
go.
just in urine or if it was in blood and everything. Fine, guys,
It is
fine.
and everything. It
And
is.
lepto now.
It's everywhere because of the vasculitis. So it is in all tissues, it can go everywhere. But the urine is of primary concern because that's where they shed it. So the highest concentrations are probably in urine. And like I said, you can get it in cracks in your skin, you can get it through mucous membranes, eyes, mouth. So mask, glasses, gloves, I would do it all. Especially if the dog is infected, they're shedding high loads. So.
And are humans kind of the same as like dogs, where by the time you notice it, it's like almost kind of too late, or?
It could be.
Yeah.
So that's the hard thing, is that each organism that gets infected might react differently. So somebody might be deathly ill, needing dialysis. Some person might have a little fever, goes away. Some person might have a fever and then all of a sudden they're having kidney problems later. And it's like, why am I, having trouble with my kidneys? Well, you had a little bit of a fever, now there's some organism in the kidneys causing problems. So.
how effective is our lepto test that we have?
So the lepto testing is hard, and again, it's because there's so many serovars. We're testing antibodies. So you give the vaccine, you produce antibody that fights off that bacterium, and so the SNAP test tests for antibody. So if you've had a vaccine, you could be producing antibody, and that could cross-react and show up on the test. And so most commonly though, if the animal is sick and there's antibody present, that test is probably positive. But if you had a vaccine just a week ago, it might cross-react. So I think Dr. J, they said that the test might show up positive for 1 to 3 weeks after you get the vaccine, because that's when you're producing the most antibody to fight. So you're ready to fight off that bacteria.